Hello guys, welcome back to my channel. This video is about the relation of the axillary artery. It's easy to remember the branches, right? So pectoralis minor divides the axillary artery into three parts: the first, second, and the third. The first gives one branch, superior thoracic. The second gives two branches, thoracoacromial artery and lateral thoracic. And the third part gives three branches: posterior, anterior, circumflex and subscapular arteries. But what is always hard for me to remember are the relations, and I'm gonna try to make them easy for you. And we're gonna only use one diagram, and the rest of it's gonna be what I'm trying to explain using the audio. So before we go into talking about the first, second, third part, respectively, and the relations, I'm gonna talk about it on a like a holistic view, in the sense that we see that the axillary artery is starting on the outer border of the first rib and then it's descending down. So if you have your body like this, it's going like this and then it's entering the arm, right? So keep that in mind. Our brachial plexus has a supraclavicular part, a retroclavicular, and infraclavicular part. The supraclavicular part consists of the roots and the trunks. The retroclavicular parts consist of the divisions, the anterior and posterior divisions of the two trunks. The infraclavicular part consists of the cords. So when we are talking about the first part and the second part of the axillary artery, most of the nerve relations are going to be cords of the brachial plexus. But by the time we reach the third part, all the cords have given their branches, namely radial nerve, axillary nerve, medial cutaneous nerve of forearm, medial cutaneous nerve of arm, musculocutaneous nerve, lateral and medial roots of median nerve. So all these branches are the nerve relations in the third part. So mostly in the first and second part we'll have cords of the brachial plexus. In the third part we'll have branches, with one exception of the medial pectoral nerve. As we can see, this branch of the medial pectoral nerve, it's coming in very soon. So that is also only exception, is the only branch that comes as a relation of the first and the second part is the medial pectoral nerve. The lateral pectoral nerve is too lateral to be a relation as of now. So that was about nerves. Now we talk about muscles. So in the first part, because it's close to the clavicle, the anterior relation is the clavicular fibers of the pectoralis major. Whereas when we come to the second part, we have the pectoralis minor as well as the pectoralis major as the anterior relation. When we come to the third part, as it's descending down, only the upper part of the third part of axillary artery is related to the pectoralis major, which will come somewhat here. So the lower part of the third part is not related to the pectoralis major. So those are all the anterior muscle relations. Now talking about posteriorly, here we'll have because this is the first intercostal space, we'll have the external intercostal muscle. We'll have the first and the second digitation of the serratus anterior, right? And also with that, the nerve to serratus anterior will also be included. So that is the posterior relation of the first part. The second part, obviously behind, will have the subscapularis muscle. The upper part of the third part will also have the subscapularis muscle. So the upper part of the third part is related to subscapularis posteriorly and pectoralis major anteriorly, not the lower part. Okay, so those are all and one more posterior relation of the third part which we'll see is the latissimus dorsi and the teres major. Okay, you can clearly see the teres major. This is the teres major, right? Right, we can't see the latissimus dorsi in this muscle. And then we can see in the second part and the third part we have the coracobrachialis, which is the lateral relation of second and third parts of the axillary artery. So that is a holistic view of how you can view the relations. Now we'll talk separately about the first, second and the third part. So talking about the first part of the axillary artery, that is coming medial to the pectoralis minor. Anteriorly, we have the skin, superficial fascia, deep fascia. Then we have the clavicular part of pectoralis major. Then we have the clavipectoral fascia. That means clavipectoral fascia is pierced by the cephalic vein, the lateral pectoral nerve, and the thoracoacromial artery. So these three are also relation to the axillary artery. Then this is the lateral pectoral nerve. This is the medial pectoral nerve. There is a loop of communication between these two nerves that we see as the anterior relation of the axillary artery. So I'm so sorry for the noise, but I can't help it. I'll try to close the door. Yeah, so there's a loop of communication between the medial and lateral pectoral nerves that comes as a relation of first part of axillary artery. If you try to take a cross section here, then you basically have your axillary artery, right, which is there, and then here you have your lateral pectoral nerve, and your inferior relation will be your medial pectoral nerve, and then here will be a loop of communication which is an anterior relation, anterior and medial also. So those are the anterior relations of the axillary, first part of the axillary artery. Skin, superficial fascia. With the superficial fascia, you'll have the supraclavicular nerves, platysma and all. Then deep fascia, clavicular part of pectoralis major, clavipectoral fascia and its piercings, and the loop of communication. Now posteriorly, as we discussed, we have the first intercostal space and the external intercostal muscle, the first and second digitations of the serratus anterior and the nerve to serratus anterior. And as I said, we'll see the cords. So posteriorly here you have the medial cord of the brachial plexus. Okay, medial cord of the this is the medial cord of the brachial plexus. You can see it's a posterior relation to the axillary artery. Laterally, we have the lateral and posterior cords of the brachial plexus. This and this. Okay, so first part ka it is lateral, then the posterior cord becomes posterior relation, but initially it is a lateral relation, whereas lateral cord remains a lateral relation throughout. Medially, what can you see here? Only one thing, that is the axillary vein. So actually these are there. The first part of the axillary artery is enclosed together with the brachial plexus in the axillary sheath. So that is a point to remember. That is the relations of the first part. The second part, again we have the skin, the superficial fascia, deep fascia. This time we have the pectoralis minor muscle, as well as we have the pectoralis major muscle, not there in the diagram. Those are the anterior relations. And we talked about the posterior muscle relation, that is the subscapularis, and I told you about the posterior cord of the brachial plexus. Laterally, you have the lateral cord of the brachial plexus and you have the coracobrachialis muscle. Medially, you have the medial cord of the brachial plexus, you have the medial pectoral nerve, and you have the axillary vein which is there throughout. Done. Second part. Relations of the third part. Anteriorly, skin, superficial fascia, deep fascia, and in the upper part, as I said, you have the pectoralis major muscles, and then also the median root of median nerve. So as I said, in the third part we start getting the branches. So this is the first branch we are seeing, that is the median root of median nerve. This one, it is anterior to the third part, and it's mostly towards the upper part of the third part, not the lower. So those are the anterior relations. Apart from the normal skin and fascia, we have the pectoralis major and the median root of median nerve in the upper part. Posteriorly, we have the radial nerve. Let us find the radial nerve, which is a continuation of the posterior cord basically. So we were saying posterior cord for the first and second, now we can continue it as radial nerve. Then we have our axillary nerve. which is coming from the posterior cord too, right? Then we have our muscles, which I said in the upper part it is related to the subscapularis. The second part and the upper part of the third part are related to the subscapularis muscles posteriorly. Apart from that, in the third part we have the latissimus dorsi tendon and the teres major tendon in the lower part. Alright, so those are the anterior and posterior relations. Laterally we have the coracobrachialis. We have the lateral root of median nerve. We have the musculocutaneous nerve, which is coming from the lateral cord, and then we have the trunk of the median nerve, which is more in the lower part. Okay, so in the upper part we'll have the median root of median nerve, lateral root of lateral nerve as the anterior and lateral relations. In the lower part as the lateral relation, we have the median nerve and musculocutaneous nerve is there in the upper part only. Medial relation, again we have the axillary vein, we have the medial cutaneous nerve of the arm, we have the ulnar nerve, and we have the medial cutaneous nerve of the forearm. 3 nerves here. So this medial cutaneous nerve of forearm and ulnar nerve are between the axillary artery and the axillary vein, right? So those are all the relations of the medial relations of the third part, and that ends the video technically. So it's very easy to remember that the first and second parts are related to the cords of the brachial plexus. Exception is the medial pectoral nerve, which is related even to the second part. And in the third part you'll see nerves. We have the musculocutaneous nerve, we have the median nerve, lateral and median roots, we have the axillary nerve, radial nerve, medial cutaneous nerve of arm, ulnar nerve, medial cutaneous nerve of forearm. So, and then we have muscles, more specifically pectoralis major, minor, teres major, coracobrachialis, subscapularis, serratus anterior, latissimus dorsi. And yeah, that's all for this video. I hope it helped you. Thanks for watching.